Good afternoon. I'm really pleased to be here and to be able to talk about the importance of injury and violence prevention research. I'd like to thank Congresswoman Roybal-Allard and Congressman McGovern for sponsoring the briefing. We're very happy to be invited to do this as you're getting restarted on the public health briefings, and also the Congressional Study Group on Public Health, the Campaign for Public Health, Safe States, Saver, Safe Kids USA, and the other partners who have helped to contribute to this arrangement. So I'm going to talk about the burden of injury and violence, some of our role in scientific research at the National Center for Injury Prevention and Control, our current budget and how much we use to fund injury prevention activities, our areas of focus, and why it's important to invest in injury and violence prevention research. So basically, injury and violence create a significant burden for us in the United States. Every year there's over 180,000 deaths due to injuries, and it's one person about every 3 minutes. It's the leading cause of death for people between the ages of 1 and 44. And over 2.8 million people are hospitalized each year for treatment of injuries, and over 29 million people are treated in emergency departments each year. And so this really contributes to more deaths in non-communicable diseases and infectious diseases combined. And I think we tend to forget that, so we did create this little graphic to help you remember that. So here's infectious disease at the bottom here, because we've done well at preventing infectious diseases and treating it, and injury obviously in the purple figure on your left. Okay, so total cost of injury. This is a tremendous amount of cost to society, and this $406 billion cost is just medical expenses and lost productivity. It doesn't account for long-term disability costs. It doesn't account for caregiver costs, or when people have to take time off from work or quit their job in order to take care of someone who has an injury that requires care. So we do know that at least this much is spent on injury per year, but this is probably a gross underestimate. The gross medical expenditures for injury every year are about $117 billion annually, and it is about 10% of medical spending in the United States. So our role, the Injury Center is the only organization in the federal government that has responsibility for addressing everything injury and violence related, from foundational research through dissemination research for all major causes of injury among all age groups. And it's the only organization to take a public health approach to do that on a broad scale. We will be celebrating our 20th anniversary next year. The Injury Center is relatively young, and the field of injury prevention and control is relatively young. But the Injury Center has grown over the years and has focused on various areas of unintentional injury and violence prevention. So our role in research is really to identify the problem, translate the science into effective prevention programs and policies and other interventions. We also collaborate with a lot of other federal agencies and partners to identify effective interventions and promote the broad adoption of those interventions. Our funding has been relatively level over the past couple of years. We had a decrease this past year in FY11. It was a relatively small reduction, about $5 million, and included a reduction in rape prevention, education, and administrative savings. In the President's budget for 2012, we have an increase of $1.5 million for the National Violent Death Reporting System. We also will be getting $20 million out of the Prevention and Public Health Fund if it remains intact for unintentional injuries. Now, there's also bad news related to all of this, and we all talk about budget and we talk about how bad things are, but funding for states really continues to be a challenge. We had been funding about 36 states in the core state grants, which meant we gave money to states so they could have injury prevention programs in their state health departments. We have cut that back this year to 20 states because the amount of money that we were giving each state was about $150,000, which could maybe buy them one person who couldn't really do a lot because there wasn't much left. So in order to provide a little bit more funding so that they could actually have an impact, we had to decrease the number of states, and this year we're funding, starting in August, 20 states. The other issue is that as the block grants were eliminated, a lot of the funding that went to injury programs was eliminated. and a lot of the block grant money was used not just for chronic disease, but for injury prevention. So while the President's budget for FY 2012 is positive, we really don't know what will happen with all the budgets, because we know there's a lot of threats to anybody's budget in this sort of this economy. We do know approximately $20 million of the $100 million in the block grant was used for injuries, violence, or EMS. So that's where the funding was going to the states out of the block grant. And then we do fund other state programs out of the Injury Center. The National Violent Death Reporting System is now in 18 states. If we get the money next year in the budget, it will allow us to fund an additional 6 states. And this has been really effective in helping us to understand more about violent deaths. And this is suicide, homicide, child abuse deaths, all kinds of violent deaths. And it combines a number of data sources so that we can get a better picture of each of those deaths and learn how to prevent them. One of the other programs we fund is RPE, which is Rape Prevention Education. There's funding that goes to all 50 states, U.S. territories, and the District of Columbia to fund rape prevention efforts, and it's a formula grant. So right now everybody's getting money out of that pot to really do something to decrease sexual violence. And they have really moved from intervention strategies to prevention strategies over the past 10 years. So that's another major area of funding. Our focus areas are several, because we can't do everything. We wish we could. But the primary areas that we're focusing on right now are motor vehicle-related injury prevention. And that is what Dr. Frieden has termed a winnable battle. It's one of the priorities for CDC as a whole. And some people might say, well, why is CDC doing something about motor vehicle-related injuries? It's because we're doing the public health approach to motor vehicle-related injuries. We're not telling car manufacturers what they need to do with airbags or what they need to do with the structure of a vehicle. What we're really working on is what happens when people don't wear seatbelts, or what can we do to enhance graduated driver's licensure laws in states? How can we help states use the evidence and the data that we have as part of our surveillance data to improve their policies so that they can prevent injuries? So we're, again, we're not doing the, sort of those technical aspects. We're really focusing more on policy-related initiatives. We also are responsive to emerging trends and increasing injury burden, while we support the translation and dissemination of some of the interventions that we've demonstrated to be effective. And we're doing this to try and use our resources wisely. One of the emerging issues is prevention of prescription drug overdose. We know that now in 17 states and in Washington, D.C., prescription drug overdoses exceed motor vehicle crashes as the leading cause of injury death. And we also know that prescription drugs, particularly long-acting opioids, are now becoming more of a gateway drug for young people than they have been in the past, and are really, and these overdoses exceed the overdoses from heroin and cocaine combined. So this is a significant issue, and poisonings and overdoses are considered an injury issue. So that's why, again, it's part of the Injury Center. Prevention of violence against children and youth, and this includes dating violence, it includes child maltreatment, child abuse, all of the things that might happen to a child as they're growing up, because we know about the long-term impacts of these on health and on the ability to function well in society. Traumatic brain injury has been a major area of focus for us too. We have some funding in that area that has gone to look at sports concussions, and you may have heard a lot more about that than other parts of traumatic brain injury. But we have developed multiple strategies for helping coaches and parents and schools decrease the incidence of sports concussions, sports-related concussions, and decrease the risks of players who have had a concussion by making sure that they're ready to return to play after the concussion, that they don't return to play too early. And so we want to decrease the long-term impact of those. So these don't mean we don't work in other areas. It just helps us to prioritize what we're doing and put our resources in the areas that seem to be most critical at this point in time.